So let us talk about some common myths around sexual disorders and sexual performance. The first myth which we want to talk about is difference between infertility and impotence. Both these terms are used interchangeably. They are commonly known, but there is a lot of difference between infertility and impotence. Infertility is the ability to reproduce, to have kids, being fertile, and impotency is the ability to have sexual intercourse. So there are times where a patient who is having a sexual problem goes to a doctor and he is evaluated for his sperm count, let's say, or for its fertility, but that is probably not required. These two are different needs, and these two functions are undertaken in the body differently. We at Vizwa Medspace, we evaluate the patients in both these lines. So there is a different evaluation for infertility, the infertility evaluation, and there is different evaluation for impotency, which is the sexual evaluation. Second myth which we want to talk about is the myths around sexual performance and masculinity. There is a common myth which people think that a person who is more masculine will have a greater sexual prowess. जो ज़्यादा जिनमें जो मस्कुलाइन होते हैं उनकी सेक्सुअल परफॉर्मेंस क्या ज़्यादा होती है, ऐसा बिल्कुल नहीं है. मैस्कुलिनिटी और सेक्सुअल परफॉर्मेंस का आपस में कोई लेना नहीं है. सेक्सुअल परफॉर्मेंस हैज़ मेनी एट्रीब्यूट्स. इसके बहुत सारे छोटे छोटे फैक्टर्स होते हैं, एंड मैस्कुलिनिटी इज प्रोबेबली नॉट वन ऑफ देम. Masculinity is indirectly related to a male sex hormone which is known as testosterone. So testosterone also induces masculinity and also has sexual function, the hormone per se. But these two are not directly related. A person who has more masculinity may not have greater timing. So this is a common myth which is there around masculinity. Why we want to discuss about this is males who are having sexual problems, they think probably that they are not masculine enough, and which indirectly affects their male ego. They think that if they are not able to satisfy their partner, they are not man enough or they are not masculine enough, which is absolutely not true. Female satisfaction has many attributes. Size is just one of them. Timing is just one of them. You need to approach a female partner in a particular way, and you need not link it with your male ego or your masculinity. So we at Vizwa Medspace, when we evaluate a patient, we understand what could be the underlying problem. It could be hormonal, it could be related to testosterone levels. So a proper evaluation is probably needed if you think that you are having a sexual problem, or if you think that your masculinity is related to your sexual performance. The third myth which we would want to talk about is myths around sexual timing. Males think that the duration of intercourse is related to their performance. As in, the longer they have sexual intercourse, the more good performance they will have. But this is not exactly true. It is generally said that if your sexual intercourse is lasting less than 1 minute, it is a problem. But any person who is having 1 minute, 2 minutes, 3 minutes is all normal. It is absolutely normal. There are people who can perform for 5 minutes. There are people who can perform for 10 minutes. And different people perform in different situations, circumstances, in different ways. For example, a person who has not met his partner for a long period of time, it is very frequently saying that if he is having intercourse after a long period of time, the timing would be less. And contrastically, if a person who is living with his wife, who is having sexual intercourse on a frequent basis, will have a longer period of time. So there are a lot of factors which are involved in this. The general rule which we want to understand is that if your intercourse is lasting less than 1 minute, only then it would require intervention. There is a lot of difference between expectation and reality. What we expect may not be what we really want. There are people who say that they perform for 10 minutes, but they come to us and they say, sir, we want to perform for a greater duration of time. But it may not be required. There are times where a female gets satisfied within 2 minutes or 3 minutes. There are times where sexual intercourse lasts for 30 minutes and the female is not getting satisfied. In such case, when an intercourse is lasting for a longer period of time, the female may not enjoy it. So it is not really about the timing. There are a lot of factors which play around female satisfaction. We need to understand a lot of things before we make a judgment about our timing, and we have to set our expectations accordingly. These days, we also come across a lot of patients who have seen adult movies and their expectation is based on those movies. Please don't base your expectations on such movies. The actors which are there in those movies, they use a lot of medications and it is unnatural and it is not the usual occurrence for the timings which they perform. And the longer the timing may not directly result in your partner's satisfaction. Fourth myth which we would want to bust is myths around the size of your genital region. There are a lot of patients who come to us having doubts about their size. There is a common saying that size matters, but it may not be actually be true. There is a general saying that if your genital size is around 5 inches, it is enough to satisfy any woman in the world. It is not that the longer the size, the more you will be able to satisfy your partner. It may not actually be true. As we know that different people have different appetite. Appetite as in, there are some people जो कि 3 रोटी खाते हैं. There are some people जो कि 3-4 रोटी खाते हैं. There are some people जो 5 रोटी खाते हैं. और इससे उनकी हाइट का या उनके साइज का कोई लेना देना नहीं होता है. Similarly, a person's height, वो कितने लंबे हैं, उससे उनके साइज का कोई लेना देना नहीं होता है. There is no abnormality. There is a normal range. And same is true for the size of your genital region. A normal size, as I said, is around 5 inches to 7 inches in the erect position. So please don't base your expectations and don't make unrealistic expectations regarding the size of your genital region. The last myth, the fifth myth that we would want to talk about is myths around masturbation. Masturbation is a normal process of, after puberty, there are a lot of males who do masturbation. And masturbation is a normal process of the body. It is like a bodily need. We have to understand that too much of masturbation is a problem, and only then probably it would require intervention. A common myth that we come across when patients come to us is because they have masturbated, they are having sexual problems, which is not exactly true. Masturbation or excessive masturbation cannot lead to sexual problems later in your life. Second myth around masturbation is that after masturbation, frequently patients come to us and they experience weakness. There are a lot of people who complain that because my semen is getting lost, I am having a lot of problems, weakness in my whole body. But let me tell you, scientifically and technically, this is not possible. Scientifically, semen or your discharge is like any other bodily fluid. जैसे कि जब भी हम we have saliva in our mouth, we have sweat in our body. जब भी sweat निकलता है या saliva हम थूकते हैं, we never think about that are we having weakness. But when it comes to loss of semen, it is a psychology that I am having probably physical weakness because of it. It is a psychological problem which is called as Bhaat syndrome. Lot of patients come to us that, sir, I am having night falls, and because of which I am having weakness. There are a lot of patients who come to us and say that I experience loss of semen during defecation. जब मैं सुबह मॉर्निंग में वॉशरूम जाता हूँ तो मेरा सीमेन लॉस होता है, इसकी वजह से मुझे वीकनेस की प्रॉब्लम होती है. I would suggest that probably the cause might be something else. It could be related to some other hormonal issue, but it is not directly linked to the loss of semen. We at Vizwa Medspace would suggest you to undergo an evaluation which can identify the underlying problem if you are having these problems. To identify all these problems and to address all these issues, we have launched a wellness assessment for males program, which is called as WAM, the WAM, the WAM assessment, which is a screening for sexual evaluation in males. We examine the patients, and it is examined by 3 different specialties. A sexologist would examine you, a physician would examine you, and a urologist would examine you, assessing you for different causes which may be there for your problem. We also would, you also would undergo some blood investigations which can further identify your problem. So this is a tool which I would routinely recommend for any person, any male who is having a sexual problem. Please undergo our WAM plan, which is Wellness Assessment for Males plan.